Hello, I'm Dr. Claudia Lontop, and today we're going to talk about a key element of non-invasive ventilation, the choice of the mask. These choices are decisive in guaranteeing the effectiveness of ventilation, but also in ensuring the patient's comfort and promoting adherence to the therapy. We will talk about the role and importance of this interface, understand the different types of interface, know what are the criteria for choosing the right interface, analyze the impacts of this interface on the effectiveness and comfort of NIV, and we will finish with the conclusions. Interface is the link between the patient and the ventilator. There is a direct impact on therapy. There is an influence on the effectiveness of ventilation and especially on adherence to ventilation therapy, and that's why it's important to choose the right mask. Look in this study published in 2013 by Professor Gonzalez in neuromuscular patients, and it is there specifically, he showed that more than 50% of patients are not well ventilated at night. You see that 45% of patients are well ventilated and the remainder, that is 55%, are not well ventilated 1 month after initiating ventilation. And what is the main reason why patients are not well ventilated? Well, it's the leaks. Leaks probably due to a poor choice of mask. Another reason why it's important to choose the right mask is to avoid side effects, such as discomfort, pain, skin lesions, as seen in this graph here, but also to avoid poor synchronization with the ventilators. It is important to know that in the presence of leaks, most ventilators can generate asynchrony because they cannot interpret the patient's flow. We will now move on to the type of mask. There are different types of interfaces. We have the nasal pillow mask, under the nose mask, nasal mask, face mask, the mask that I called hybrid, and other types of masks. We'll see all this in detail. But before we get into the details of the types of masks, I would like to show you very quickly the components of a mask. In point number 1, we have the connections to the circuit. Point number 2 is the headgear. What is called the headgear is the part that goes around the patient's head. Number 3 is the body of the mask. Number 4 is the ties. We will see in detail that we have different types of fasteners. The 5 is intentional leaks. When we use a single limb circuit, we will have to have leaks that we call intentional, because this is where the patient will exhale. The 6 is the bubble, and the 7 is the anti-asphyxiation valve. This is in detail what the components of a mask are. Let's start with nasal masks. What are the benefits of having a nasal mask? First of all, it is less bulky, is better tolerated by patients, especially patients who have claustrophobia. It also allows communication, since it will only take the nose, and therefore the patient will be able to communicate and he will be able to eat too. And it decreases dead space, which can optimize ventilation. But there are also disadvantages. Sometimes they are not suitable, especially for patients who breathe with their mouth open. For the risk of nasal dryness, additional humidification may also be required and there may be leaks if the pressure is too high. We're going to start from the smallest to the largest in that sense. Here we have some examples of nasal pillow masks. We call nasal pillow masks when there is a part of the mask that will go inside the nostrils. That's why they are called nasal pillow masks. We have under the nose masks, that is masks that don't cover the entire nose, but a little bit below the nose. We have different types and models, sometimes with the leaks that are deported, as we see in this example, and here too. We have nasal masks, masks that only take the nose with different supports. Some have a frontal support, as seen here. No frontal support, but rather lateral support. And the same, here we have another type of mask with a deported leak. Let's move on to the face mask. The advantages of the face mask that is suitable for patients with nasal obstruction or mouth breathing that is predominant, offers a more stable pressure, that is the mask is a tiny bit more stable, which can limit the risk of leakage a little. On the other hand, the disadvantages are that it can of course be more bulkier, especially with a feeling of claustrophobia for some patients. There is more dead space because there is more space in the mask. It can influence the effectiveness of ventilation, and it can generate more skin irritation because it takes up more surface area. Here are some examples of face masks. We have different configurations. For example, with a support, as seen here with a frontal support. No frontal support. And we also see different types of materials. We will look in a little more detail at different types of materials. For example, this one, it's made of foam. There are others that are made of silicone. We'll see that in more detail. Other models. If there are so many models, it is because there are different types of facies, and therefore we have to adapt to each patient. Sometimes you have to try several types of masks. And here we have the so-called hybrid masks, or we could also call them subnasal curls. Because if we see clearly here, it doesn't take the nose completely, it just goes under the nose and covers the mouth, here the same. And sometimes we still have the leaks that are deported air, and others are the intentional leaks just at the exit. Sometimes when we can't get by with the previous masks, we are forced to use masks really in extreme cases. And that's total face masks. The advantages are ideal for patients who already have facial deformities or significant skin wounds that prevent you from not having a point of support, whether on the nose or on the mouth. The disadvantages, of course, are a feeling of claustrophobia since they will take up the whole face, and it is sometimes necessary to adjust the headgear a little more to avoid leaks. We will see two models that exist on the market. These are the masks that we call total face. They will completely cover the entire face. An interesting element to keep in mind is the chin strap. In fact, the chin strap will prevent the mouth from opening during use, whether by a nasal mask or sometimes you are forced to put on a mouth mask, that is to say a face mask, and put on the chin strap to avoid mouth opening. The choice of mask is based on the balance between effectiveness and tolerance. How are we going to have efficiency? We must ensure a good seal and limit leaks. And of course, you shouldn't have obstructive events because sometimes some masks can cause them. We'll see that in a little more detail. And on the other hand, we need good tolerability, that is good ergonomics adapted to patients. And absence of secondary effects. How to choose if to use a mask? You have to start with something. In this diagram, I decided to start by asking the patient if he can answer if the patient breathes with his mouth closed or his mouth open. If the patient breathes with their mouth closed and says yes, I will go in my first configuration. I can start with a under-the-nose mask, a nasal pillow mask, or a nasal mask. If the patient tells me that he is uncomfortable or that he has leaks, I can try a chin strap, for example. If, despite the chin strap, the patient is uncomfortable or leaks, I can put on a mouth mask. And then, if the patient tells me that he is breathing with his mouth open, that is, the mouth is not closed, I go into this configuration. I'm going to start a mouth mask. If there is discomfort or persistent leaks, I will put on a hybrid mask, for example, in cases where the patient has a nasal injury. If there is any discomfort or leaks, I can add a chin strap or a full face mask to these mouth masks. We know that there are different types of faces. There are patients who sometimes want to continue using glasses. There are patients who have a mustache, a beard, who have no teeth, for example, who have a slightly flattened nose, a longer nose, a round face. There are different types of faces. We have to adapt to each face and each size. It's very important to find a good size. To do this, there are several things that can be done. On the one hand, we can try guides that offer us certain mask manufacturers to measure the exact size. But also, and this is the most important thing, is to try with the patients. We will have to try different types of masks until we find the mask that gives us the best effectiveness and comfort. Recent studies have confirmed that the choice of mask can influence the effectiveness of ventilation. This study, published by Antoine Liotard in 2021, it is a crossover study with 30 neuromuscular patients. This is very important, It is a crossover study where it starts with a nasal or oronasal mask, and then it alternates, and it will measure the oxygen saturation, the average oxygen saturation, the desaturation, the TST90, the desaturation index, the average of transcutaneous carbon dioxide, the average time the mouth opens and leaks. So he found that regardless of the mask, whether it's a nasal mask or a face mask, there was no impact on effectiveness or reduction in side effects. On the other hand, what he is saying is that when you make the transition from one mask to another, at that precise moment in that week, in fact, it can have a little reduced effectiveness. So you have to know that this is possible in the sense that when you change your mask in the following week, it can have an effectiveness that will be impacted. Another thing that is important in efficiency is not to have obstructive events when wearing a mask. The first part of the night, the patient uses a nasal mask, and the second part a face mask. As we can see here, we will see that when the patient uses the nasal mask, there are no events. There are no obstructive events. There is almost no hypopnea. On the other hand, when the patient is switched to a face mask, obstructive events appear, probably due to this phenomenon where we see that the glottis can fall out, probably because we tightened the mask too much. In this study, which was published by the Dijon team, we show that a patient who uses a face mask, we see here the desaturation and also the events, as seen here. And if the same patient uses a nasal mask, we see the desaturation line, which is much more stable and has almost no events. Now we're going to move on to the tolerance part, and one of the key points is to have good ergonomics. For the patient's different situations, for example for a patient with a hand disability, it will be important to favor masks that are easy to put on and take off the masks, such as this type of mask, which are easier to take off and put on. Same thing, magnets, hooks and a rope with which you can easily remove the masks. These masks allow us to do an easy release, that is to easily remove the mask. And also masks that are smaller if the patient does not have mouth leakage. Another point in ergonomics is that sometimes the patient needs to read, or in his habits, he wants to read, so you have to have a good field of vision. Sometimes they even have glasses, so masks without front support should be preferred, as we see here, for example, for this type of need. For patients who bask on their sides, masks with frontal support should be preferred because they will be a little more stable. And here you will find some examples, some masks with a front support. For patients who do not have teeth, it is always necessary to test in real conditions. That is, if the patient sleeps with dentures, they should be tested with them. If he sleeps without dentures, you should test in this situation. And in these cases, you should choose masks that have a good support on the lower maxilla. Comfort is linked to the absence of injuries. So you have to have a good seal. And for this, hair must be avoided. If possible, ask the patient to shave or trim the beard. Avoid creams before applying the mask because the cream, what it will do is that the mask will slide. Avoid big plaster because we will lose the sealing of the mask. Another problem is that the patient may be allergic to different materials. I'm going to show you the different masks with the materials they use. For example, here we have all the silicone masks. There are different materials such as gel, foam, fabric, but my fabric exists with more or less effectiveness. But sometimes if the patient is allergic, we have no choice. Of course, a mask that is comfortable, it does not cause injuries, but it also ensures a good seal. A few tips. As a reminder, the sebum secreted by the skin can cause the mask to slip. So it's very important, as much as possible, to cleanse the face well before putting on the mask, but above all not to put on cream. It is important to clean the mask bubble every day, that is the entire part that is in contact with the patient's face. It should be washed every day. And the headgear and shell, which are not in direct contact with the patient's face, can be cleaned once a week. If, despite all these tips, the patient has injuries, It is important to know that there are different types of dressings: fine dressing, fine compress, fine hydrocolloid, and Gecko patch. Therefore, it is necessary to favor the thinnest possible dressings as much as possible. And in case of injury, you will have to alternate another type of mask to leave the skin healed. For example, if you have an injury on the bridge of the nose, you will have to use a mask that does not have any support on the nose. We have different options. It can even be a nasal mask with a chin strap, or in extreme cases, we will have to use a total face mask. In addition, in the event of an injury, in patients who are ventilated for more than 12 hours, dependent patients, and even without injury, it may be advisable to change the support points during the day. And for this, we can use different types of masks, nasal masks for example, and even mouthpiece ventilation. But for mouthpiece ventilation, you will have to make appropriate adjustments for its use. Sometimes we are surprised because the patients themselves are very inventive. They can innovate. For example, here we have a patient who had an opening of the mouth. He didn't want to use a chin strap because, as you can imagine, putting on a mask and then a chin strap can be something not very pleasant. So, what did he do? He decided to sew on his own, as seen here. A little cloth and then a hook, right here, and it prevented this patient from opening her mouth. This patient, in fact, she sometimes wanted to use this type of mask during the day, but she wanted to take it off easily. And as we can see, she has a deficit in her hands, so it's difficult for her to completely remove the mask. So she had changed the headgear for a small elastic band that she could unhook quite easily. Of course, probably there were leaks, but the patient had so much floor, so it's hard to say no, because either she was using masks, even with a little leakage, but it was the best compromise for her. With that, what I wanted to say is that in fact it's very important to adapt to patients. Communication is very important. Therapeutic education. You have to explain to patients why it's important to 1. Use ventilation well, 2. Not to have leaks, which makes ventilation less effective, and what should be done to avoid injuries, and in case of injury what should the patient do. In conclusion, the choice of the NIV mask is a determining factor for success. These choices are based on a balance between effectiveness and tolerance. A good mask is one that provides effective ventilation without leaks or obstructive events, is well tolerated by the patient, without discomfort or pain, is ergonomic and tailored to the specific needs of the patient. And it's very important to try in real situations, to educate the patient and to prevent side effects. Thank you very much for your attention.